Medicine has come a long way in the past few decades. Today's doctors and nurses have some amazing tools at their disposal. The latest high-tech equipment,
Take a big breath for me.
modern pharmaceuticals and procedures. But in many cases, the most important tool a medical professional needs is information. Information about you, the patient.
I do not see any effusions.
What are your allergies, lab results, past procedures?
So I need 81 milligrams of aspirin, just a baby aspirin, please.
What medicines are you taking?
81 milligrams of a baby aspirin?
Correct and up-to-the-minute information about a patient's history is a vital part of treatment. And yet for many, access to this most important tool still lingers in the dark ages, scattered around filing systems in different offices, subject to retrieval by hand, accessible only by phone or fax.
Good morning. Welcome to Children's Hospital.
There's a better way.
Her last name
It's called Health Information Exchange.
and her first name?
With Health Information Exchange, your medical records are available electronically to your participating caregivers instantly, right when they need them.
Hello.
The advantage of an electronic health record is that everything is in one place. That includes all of your information from your current visit, as well as information from previous visits at this site and at other sites.
Do you remember what happened?
So when I check in a patient who, say, has a broken arm, as I'm talking to them, the x-ray can appear on my computer screen. I'm able to look at all of their previous information, including what medications they're on, what happened with them in the past, and what tests they had done, and the results of those tests. This means I don't have to repeat tests that have already been done. I can see the results of those tests, so I know more about what's going on than what the patient can often tell me in their words.
This network of electronic medical records can be within a single hospital
Normal sinus rhythm, no blocks.
or between participating hospitals, doctors, and clinics.
Lung is good, his trachea is midline.
Not only does this improve your medical care, but it also better protects the confidentiality of your personal health information.
In the past, we would ask information to be faxed to us, and there are all sorts of potential errors and breaches of confidentiality with faxing. It could be sitting on the fax machine, it could go to the wrong fax machine.
But with Health Information Exchange, your medical information is secure, held in highly protected data systems. Anyone who pulls up your information is tracked.
There's a complete audit that takes place as to who's accessing the information, what information they're looking at, so that and those records are kept so that we'll know exactly who's been in there and what they've looked at.
Okay, where'd you hit your head?
Being able to access information from multiple healthcare facilities on one patient makes me a better doctor. It makes me more efficient and able to provide safer and higher quality healthcare for my patients.
Health Information Exchange. Better information, better medicine, better care. The technology is here today to make your care safer, more private, more accountable to you. Ask your doctors if they use Health Information Exchange.